if you take a disc and you lay it such that we're looking at the top of it, in the center you have a nucleus pulposus, which is like a jelly donut. The periphery of the disc is called the annulus fibrosus, and that's like a steel-belted radial tire. If you get a tear in the annulus fibrosus, then the jelly donut, so to speak, can leak out, and that's your typical disc herniation. Okay, you can get leakage of the nucleus pulposus, so it's more like a gel, like a fluid or a jello. It can leak into the posterior part of the disc, and we call that an annular fissure. We used to call them an annular tear, but the word tear kind of implicates trauma, and it's not necessarily trauma at all. What really is happening is you get a lack of blood supply to this disc, and then the outer part, the annulus fibrosus, starts to fail. It starts to crack. And then this nucleus pulposus can start leaking into the cracks, and it can even just dry out totally. That'd be called a desiccated disc. And when it's dried out, it'll lose height. So let's say this is a normal height of a disc. It just has a little bit of an internal fissure right here. They call it an annular fissure because it's the annulus fibrosus. And if the disc really dries out severely, it'll lose height. So this would be a degenerated disc with loss of height. Okay. All right, now here's a little bit about terminology of discs. A disc typically should only be the height of the disc space. So if it protrudes posteriorly, that's called a protrusion. If it protrudes posteriorly and then extends upward or downward, beyond the disc height level, that's called an extrusion. And these are kind of code words, which basically tell the surgeon, this probably doesn't need any surgery. This might need surgery. This is a bigger disc herniation. Okay, this is what's called a Schmorl's node. A Schmorl's node is just a fancy way of saying the disc is herniated into the vertebral end plate. So the end plate was soft for whatever the reason, and the disc is herniated into it. You see those all the time, Schmorl's nodes. Most of the time they're asymptomatic, but they can be symptomatic in the early phase. All right, now here is what's called epidural lipomatosis. So the dura is the sac containing fluid, containing the cerebral spinal fluid and the nerve roots. Outside of it is called the epidural space, and you can have accumulation of fat in the epidural space. So that's epidural lipomatosis. So lipoma is fat. Lipomatosis just means excessive fat. I see this all the time. So what I'm trying to say here, it's obvious already, I hope, that diet and obesity are highly relevant to back pain. When a person gets real fat, they start putting more fat into their spinal canal, and that can compress the nerve roots. In addition, the atherosclerosis in that aorta is going to be blocking up these arteries to the spine, leading to degenerative disc disease.